This is a demonstration of how to make a relative motion extension orthoses. So we'll get our patient Vita to put her elbow on the table, and if you hold your middle finger up, and what we're trying to do is keep the natural curve of the hand and not have the orthoses being pulled back into extension. So we pop this through, we'll just relax you a little bit more there, great. And I want to have the fingers comfortably together, not sort of being separate or squished too close. So pull this component around and press that here. Put a little groove on the back for comfort, and then twist this one around. Measure where it's to go and just trim that shorter. And pulling that in and then pinching that together. And if you can let go of your middle finger now, good. And we just push that so that it bonds, and then we can use the heat gun and heat that up and smooth the edges as well. And just show me what your fist is like now. Great, and out straight. Demonstration of how to make a relative motion extension orthosis for the index finger. Thank you. I'll get you to hold that up, and what I'm going to do is bring and bond those together, and I want to follow the proximal phalanx coming around the other three fingers. Curve the edge. And if you keep holding that, that's terrific, and bond that section as well. And if you let go of your finger now, so I'll maintain the relative extension, and between these fingers I'll just put a little indentation between the fingers so that there's a little bit of space there, and we'll let that set in that position. And relax your fingers. Good. So we want to keep the natural curve of the hand as well. Maintain the arch of the hand. And we're just about set now. So I'll get you please to straighten your fingers all the way out and then come down into a fist. Great. This is a demonstration of a relative motion flexion orthosis. So we'll do this for the ring finger. So pop that down into relative flexion. So I'll get you to hold that down, this finger here. Perfect. And I'll loop the small finger first. And then what I need to do here is actually twist the plastic down a little bit so that I can get the relative flexion compared to the small finger. And then relax these two for me. Terrific. And cut the excess plastic off. A nice curved edge. And you can stretch that down and also maintain the relative flexion. A little bit of separation between the index and long finger. And relax now for me. You can let go of your finger, and now I can just keep the curvature of the hand as well, as that's the most functional position that she'll be using with her grasp and release. Nice and relaxed fingers. Terrific. And you can see how the PRP joint naturally sits in extension even when she is relaxed. So that's set now. So straightening your hand out, terrific, and then closing into a fist. Once removed from the patient, I put the heat gun onto the orthosis, and by doing this it just heats where the plastic has been bonded, and by smoothing that over you can get rid of any rough edges but also increase the strength to the orthosis. If I was to put this one on now, this was the relative extension for the index finger. If I was finding that the distal portion of the orthosis was limiting flexion, I could spot heat this area and then roll that forwards as well. So this is the finished relative extension for the index. This is the finished relative extension for the middle or long finger. and this is the finished relative motion flexion orthosis for the ring finger.